Hi, everyone. This is Dr. Kamir Hidayat, Chief Architect here at GEMMA. I'm really excited to introduce two new thyroid panels to our catalog. In this video, we're going to briefly review the epidemiology of thyroid disorders. We'll touch on the concept of functional thyroid imbalances. We'll talk about the importance of addressing these subtle and gross imbalances of the thyroid, and then we'll introduce the two panels, the GEMMA Thyroid Quantitative Level 1, the GEMMA Thyroid Functional Level 2. Let's get started. Thyroid imbalances are the most common endocrine disorder in the world, accounting for 12 to 15% of the population. Now, this is just considering clinical and subclinical states of hypothyroidism and hyperthyroidism. And testing is done typically by just measuring thyroid stimulating hormone, or TSH. This approach catches this 12 to 15% of the population, but it oftentimes misses an even larger percentage of people with something that we can call functional disorders. Now, functional thyroid imbalances are occurring in patients who are symptomatic with normal levels of thyroid stimulating hormone and often free T3 and or free T4. Alternatively, they may have suboptimal values within the normal range or completely optimal values, but abnormal ratios. And these ratios are what we explore in both of these new thyroid panels. These functional thyroid imbalances are underdiagnosed because the lab changes are subtle, as well as the signs and symptoms. And sometimes the consequences, as I'll show you, are latent or take a long time to appear. So it's really important to address these functional or subtle thyroid imbalances early to maintain the healthiest and greatest level of longevity for your patient. So, for example, studies have shown that these subtle or functional thyroid imbalances, these are values within the normal range, but not in the optimal range, can be associated with onset of diabetes and worse glucose management in patients with diabetes, as well as with obesity. These subtle imbalances can also be associated with cardiometabolic disorders such as atherosclerosis and risk of death after myocardial infarction. They're also associated with neurometabolic disorders such as diabetic neuropathy and dementia, as well as osteometabolic disorders. So let's introduce the two panels. We have the thyroid quantitative level 1 and the thyroid functional level 2. Both panels use the basic set of thyroid hormone measurements, TSH, free T4, and free T3. Now, if you're ordering a thyroid quantitative or functional level 2, you only need two of these three to still get in-depth personalized results. That could be TSH and T4 or T4, free T4, and free T3. The thyroid functional panel expands the set of what's possible by including two enzymes, lactate dehydrogenase or LDH, and creatine kinase, also known as CK or creatine phosphokinase. The thyroid quantitative panel uses 56 different levels of analysis in order to arrive at its conclusions, thanks to the ability to use these ratios I mentioned earlier, TSH over free T4 and free T4 over free T3. The thyroid functional panel with the expanded lab profile, including the two enzymes, uses 125 different levels of decision making to deliver a highly personalized report that you can share with your patient. Both of these panels will include two different diets that you can recommend to your patient based on if they have an underfunctioning or overfunctioning thyroid. There's a guide to lifestyle, environmental, and iatrogenic factors to consider. There's a brief review of signs and symptoms so you can better correlate the lab results with the patient's clinical picture. And it can also help you more precisely determine what you want to evaluate on physical examination during your follow-up visit with the patient. Both panels have a discussion and education section, which explains all the science and a review of the clinical studies that we use to develop these panels. And finally, both of them include drug-drug, drug supplement, and supplement-supplement interaction. So if your patient is already on thyroid medication, thyroid replacement therapy, you can safely know how to administer supportive treatments with various types of medicinal plants, vitamins, minerals, and amino acids. If you're new to GEMMA or you'd like a refresher, once you log in to the website, which is www.gemmabio.com, you'll be given two different options, explore and evaluate in most cases. Explore is if you want to understand a little bit more about the panels to make sure if they're what's right for your patient. Here we have the thyroid quantitative screen. You can open this up and we see that the various usages and indications for this panel are indicated. So going beyond strictly evaluation of thyroid hormone level imbalances, we can also look at issues like fatigue, weakness, asthenia, weight issues, infections, insomnia, anxiety, depression, poor memory, etc. You can, if you're not sure which labs you need, you can click right here and we can scroll down and you can quickly review the labs that you would need, which are 11A, TSH, free T3, and free T4. Now, if you have a broader expansion of labs or you're interested in looking at more subtle issues, you might want to get the thyroid functional panel. The functional nature of this panel is derived from the fact that we are using these two enzymes I mentioned earlier, LDH and creatine kinase, to functionally evaluate how thyroid hormones are working at the level of the tissues and the cells. I'll discuss this more in a subsequent video. Now, once you've decided what you want to order, you can go here to evaluate. And you see here that we have our two different levels of thyroid. We have the quantitative screen at 11A, which are the three basic thyroid hormones. Or you can click on 12 to also include these two enzymes. And once you select them, you'll go back and confirm which panels you want to order. Of course, if you order the thyroid functional, it includes everything in the thyroid quantitative. So if you have the extra enzymes, you can just order this panel. If you only have the basic thyroid hormones, you can order the thyroid quantitative. Now we're going to do a side-by-side comparison of the two panels. On the left half of your screen, we have the thyroid quantitative. On the right half, we have the thyroid functional. Remember, the thyroid functional has two additional biomarkers, which are LDH and CPK, and they give you an expanded level of results. So as you see, there's an introduction here which explains the coloration system to indicate when labs are normal, but an optimal, normal, but suboptimal, high or low. And the panel starts off by showing you the results of your basic hormone studies. We see that in this patient, all their labs are completely normal. This is the same patient with the same results on the two different panels. So you see that the TSH is normal at 3.8, but the system has flagged it as suboptimally elevated. Free T4 was normal at 11 picograms per milliliter, and the system flagged it as suboptimally low. And finally, the free T3 in picograms per milliliter was flagged as low. So we have the results of our tests, and now we can start to look at thyroid kinetics. Thyroid kinetics refers to the rate of response and activity between the pituitary, where thyroid stimulating hormone is produced, and the thyroid gland where free T4 is produced and some free T3 is produced. And we can see that the ratio is suboptimally high, and there's an interpretation of functional subclinical hypothyroidism based on suboptimal T4 and suboptimal TSH. And then there's a little discussion here of some clinical symptoms and signs you can look for, and a summary of some of the risks that your patient may face, even with these normal values. When it comes to the free T4 to free T3 results, we see that the ratio is high at 5.24, and there's a commentary on this. So let's continue with the thyroid functional. Since we have two additional tests here, we have the thyroid index, which is looking at the functional activity of thyroid hormones at the cellular level, regardless of the circulating levels. And we see that even though the free T4 and the TSH were completely normal and the T3 was slightly low, we see that the thyroid index is actually quite low. So despite these values, the actual effective action of thyroid hormones is lower than was anticipated. And then there's a further commentary on what this could mean. Now, the thyroid yield is an evaluation of another type of thyroid kinetic, but how the pituitary is ultimately helping to stimulate or not sufficiently stimulating this functional thyroid activity at the cell level. And in this patient, it was also low. The next section is treatment guidance, and you can see here, for example, with this TSH to T4 ratio, there's a reminder that the value is suboptimally high. And there's some advice if your patient is on already thyroid hormone replacement therapy, as well as different types of plants, vitamins, minerals, and amino acids, as well as dietary recommendations. There's also some recommendations for follow-up testing with different GEMMA panels. Same thing is true for the free T4 to free T3 ratio, and for the thyroid and thyroid yield. Now, the next section has the diet, lifestyle, and environmental modification. So if your patient, for example, has an underperforming thyroid, these thyroid supporting foods may be beneficial. And the superfoods, which are the foods with the highest concentration of the beneficial substances, nutrients for the thyroid, are listed first, and then they're categorized by different concentrations of different nutrients. If your patient has a slightly overactive or overactive thyroid, there are other foods you could recommend, or if their thyroid is sluggish, you could recommend avoiding these foods. There's a guidance here to different types of lifestyle factors which can affect the thyroid and different types of interventions. There's a list of organic pollutants which have been known to be goitrogenic. There is a GEMMA meditative breathing technique that you could also recommend to your patient. And there's a discussion of some iatrogenic factors related to medications that can affect the thyroid. Section 4 includes a review of the signs and symptoms of subtle and gross abnormalities of the various thyroid hormones. This is from a classical medical perspective as well as the expanded endobiogenic perspective. And then finally, there's a discussion which reviews the production and action of thyroid hormones, both within the gland itself and extra glandular activities. We discussed the evidence around the ratios, how we created them, how we chose the cutoffs. And then in the treatment consideration section, we go over the drug supplement, drug and supplement interactions with a convenient table to summarize all of these precautions you might want to take. After that, we have the scientific references if you want to investigate further. and then a summary of the labs that you entered. We look forward to you using the thyroid panel at GEMMA, and stay tuned as we go over some case studies with each of these panels.